Hey, welcome to the explainer. You've definitely seen this before, right? A doctor glides a little wand over someone's skin, and boom, a live image of what's inside pops up on a screen. That's ultrasound. It's a technology that literally gives surgeons a window into the body without ever making a cut. So how in the world does it actually work? Let's get into it. This is the big question for any surgeon. If something's wrong on the inside, how do you get a really clear picture of the problem before you have to operate? Well, the answer is a field that's totally changed medicine: diagnostic imaging. So here's what we've got on tap for this explainer. We're going to start with the basics of seeing without a scalpel. Then we'll dive into how sound actually creates a picture. We'll look at the big advantages of ultrasound, see where surgeons use it all the time, but also understand its limits. And finally, we'll take a little peek into the future. Long before a surgeon even thinks about picking up a scalpel, they have this whole toolkit of ways to see what's going on inside. You've got your x-rays, right? Perfect for bones. Or CT scans, which give this incredibly detailed 3D view of the body. These tools make diagnosis and planning for surgery so much more precise. But here's the thing. Not all imaging needs radiation. And that brings us to the star of today's show, ultrasound. It's actually the second most common imaging method out there, and it pulls off its magic using something totally different: high-frequency sound. Okay, so how does this actually happen? How can you turn simple sound waves into a detailed live picture of your organs? It kind of sounds like science fiction, right? But the actual physics behind it are, well, they're surprisingly cool. Let's break it down. Basically, ultrasound is exactly what its name suggests. It's ultra-high-frequency sound, way, way beyond what a human ear can pick up. We're talking in the range of 3 to 20 megahertz. And the most important thing to get here, this is all sound. No radiation involved. None. The whole thing works in 4 simple steps. First, this handheld thing, called a transducer, sends little pulses of sound into your body. Second, those sound waves travel in and then bounce back. They echo when they hit the edges of different tissues. Third, that same transducer listens for and detects those returning echoes. And finally, a computer takes all that data, how long the echoes took to come back, how strong they were, and builds a live picture. It's almost exactly like how a bat uses sonar to navigate in total darkness. Now, getting a static image is pretty amazing. But in medicine, what's often way more important is seeing things in motion, like, say, blood flowing through an artery. To do that, you need a special trick up your sleeve. And that's where something called Doppler ultrasound comes in. It works by measuring this tiny, tiny change in the sound wave's frequency as it bounces off moving things. Most importantly, our red blood cells. By analyzing that shift, the machine can figure out not just the speed of the blood flow, but the direction it's going in. This lets the surgeon see if an artery is blocked or if blood is flowing backwards. And that kind of information, it's absolutely priceless. Okay, so you've got x-rays, you've got CT scans. Why would a surgeon pick ultrasound? Well, it turns out it has some huge, game-changing advantages that make it just essential in the surgical world. Let's see what makes it stand out. What's the single biggest advantage? This number, right here. 0. That's how much ionizing radiation you're exposed to during an ultrasound. Unlike an X-ray or a CT scan, it is completely radiation-free. That makes it incredibly safe, especially for kids, for pregnant women, or for anyone who needs repeated scans. This is where you really see where ultrasound shines. X-rays are the king for bone. CT scans are fantastic for a big overall assessment. But ultrasound? It's the master of soft tissues, fluids, and organs. And here's the real game changer. It's live. It's real time. A surgeon can see things moving as they happen. Then you add in the fact that it's relatively cheap, and you can see why it's such a go-to tool. So because of all these perks, ultrasound has become this absolute workhorse in surgery. Let's take a look at the incredible range of things surgeons use it for every single day. I mean, just look at how versatile this thing is. For anything to do with the liver, gallbladder, or kidneys, it's often the very first test a surgeon orders. It's used to guide needles with pinpoint accuracy for things like biopsies. It's the best tool for looking at the thyroid and testes. It's great for soft tissue injuries, like torn ligaments or tendons. And in the ER, they use it for something called a fast scan, basically a super quick check for internal bleeding after a major trauma. And sometimes the level of detail you can get is, well, it's just mind-blowing. There was actually a case where an ultrasound found a parasitic roundworm just hanging out inside a patient's bile duct. Think about that. The technology is so precise it can spot a tiny worm deep inside the human body. Incredible.
Okay, but let's be real. No technology is perfect, right? Ultrasound is amazing, but it has some very real limits. And to really understand it, you have to know what it can't do. This quote right here nails the biggest challenge with ultrasound. The quality of the scan depends so much on the skill of the person holding that probe. It's a live, dynamic process. The important information comes from physically moving the transducer around, applying the right pressure, and interpreting what you see in the moment. It really is part science, part art.
And here are the other big weaknesses. Basically, bone is a total roadblock for sound waves. They just can't get through it. And air or gas, it just scatters the sound waves all over the place. This is why you can't use ultrasound to look through the skull at the brain, or to get a clear view of organs that are hidden behind your intestines. It also just doesn't work as well in larger patients, because the sound has farther to travel to get to the organs and back.
So, where does all this leave us? Well, even with its limits, ultrasound is clearly a cornerstone of modern surgery. But what's next? And what's the big takeaway here?
And that's really the bottom line, isn't it? It's safe, it's live, and it's affordable. It gives surgeons a kind of insight that was basically unimaginable just a few generations ago, empowering them to see the unseen and make critical decisions on the spot. And that brings us to one last really fascinating thought. For centuries, the stethoscope allowed doctors to listen to what was happening inside the body. Ultrasound lets them see it. As this technology gets smaller and cheaper and even more powerful, you have to wonder, could a portable, pocket-sized ultrasound one day become as common as the stethoscope? A tool not just for specialists in a hospital, but for every doctor to get an instant look inside the human body. Now that's a future to think about.